Welcome to Skinfluence, the podcast where we talk all about your health, your skincare, and we want to make you healthy inside and out, make you look and feel as good as possible. And today is a special episode because it is our first guest episode on the Skinfluence podcast, and I am overjoyed to be joined by Dr. Craig Clayton. He is a functional biomimetic dentist here in the Treasure Valley area, who I had the pleasure of meeting maybe 3 years ago, as you were just getting started in your practice and starting on social media as well. And you have really become a force in the dental community here locally and probably at a much larger scale with the influence that you've garnered. So thank you for joining us on the podcast today.
Thank you for the invitation. I didn't realize I was the first guest on this.
You are, yeah.
So I feel very honored.
The first guest for Skinfluence, because obviously we talk a lot about dermatology and skincare, but my approach to health is much more than just covering up symptoms or using creams and things. And I really like to understand what's going on inside somebody's body that may be contributing to the acne on the skin, the psoriasis, the eczema. And there's a lot of miracles that we have in medicine that can make these symptoms go away, but that doesn't always fix the underlying problem. And you are, on your website, it says a biomimetic dentist. Tell me, what is a biomimetic dentist?
Okay, good question. Biomimetic dentist refers a lot to the technical art of dentistry. Mm-hmm. So when we have to repair teeth, which is part of the job, not why I got into dentistry, and we'll go into that later, but when we do have to fix teeth, we need to respect nature. Mm-hmm. The virgin tooth, untreated, is the most ideal structure. It's perfect the way it moves. When we bite, our teeth move and deform and distribute stresses so that they don't break. And when we fix teeth, we have to do it in a way that respects that and restores it. Because if we don't, that's when we start to run into issues down the road. Because then there's this tug of war between the man-made material and the natural structure. And then we can get decay underneath fillings, underneath crowns and failures, versus the biomimetic approach. If we use materials and techniques that imitate the original tooth structure, then the tooth and the material can function in harmony, and we lower that risk of having to fix that tooth again down the road.
I think we've certainly all seen people who start having dental problems. They're getting treatments done and they're spending tons of money, and then it seems like their problems never end.
Yes.
And so maybe with some of the traditional roles, we're, masking that, putting a crown on something where there might still be a problem underneath that we're now not noticing. Is that fair to say?
Yeah, absolutely. I have a vendetta against crowns. Yeah. Those are some of our reels that have gone most viral, and that's because it's overprescribed. But yes, when a tooth has to be repaired, it enters what we call the tooth death cycle in biomimetic dentistry. So as soon as you treat a tooth at any degree, it's now at risk of needing treatment down the road. And even the best fillings, crowns, onlays, whatever, still have a lifespan. They're not like normal tissue. And so once you get into that cycle, especially if things start failing, then it's a filling, a larger filling, commonly recommended a crown. The crown fails, the tooth breaks, you are given the chance to do root canal treatment or take the tooth out, and then thousands and thousands of dollars later for one tooth.
Yeah.
Here we are, and then you multiply that by multiple teeth if someone's prone to getting cavities. So biomimetic dentistry, the goal is to stop the cycle. Prevention is best. That's what I'm big on. But
absolutely.
If we enter that cycle, let's fix the teeth in a way that prevents future treatment.
Right, which seems like a very reasonable approach.
Right? Yeah.
But it's a non-traditional approach in modern dentistry, it seems like. I know that the interest in your field has grown significantly over the last few years. But when you got started in dentistry, was this your goal, to get into this type of dentistry and to a completely different approach to it? It's not like an approach that any dentist I've had has ever taken.
No, not at all. I wasn't aware that this even existed. We were taught some bits and pieces of this philosophy, but not much. And in fact, about a year and a half into dental school, I just thought, what am I doing? I chose the career because I thought, I get to work with my hands, become a doctor, help patients. Dentists seem to have a good lifestyle.
Sure.
And I got a year and a half in. I'm like, what am I doing?
What were the things that were making you feel disillusioned at that point?
I felt like so much of the emphasis was on just doing the technical work of dentistry. Like there wasn't, and of course we were going through the classes that teach you about disease and what's going on in the body when you get cavities and gum disease, and learning how to identify pathology, like cancer in the mouth and signs of other diseases. But when it came down to it, like we needed that to pass the boards and understand, of course, but I felt like there was so much focus on the technical work that I just felt like this is not what I got into this to do. I don't just want to be a tooth technician. And that was the only path I saw moving forward was you go and you fix teeth all day and that's it.
Yeah.
But I chose to stuck it out with the hope that I'd figure something out. Honestly, I just wanted to open a dental practice, make it really financially successful so I could pay off my loans and leave.
You're kind of, I think everybody gets to a point in professional school where they're like, holy cow, but I'm in so far. I have to keep going because I don't know how else I'm going to be able to pay off these loans.
Yeah.
Yeah.
Yeah. With my other interests, they're certainly not going to go become a forest ranger. I'm not going to be able to pay off a dental school loan.
Yeah. Well, unless you just live so far that nobody can find you.
Yeah, that's right.
So you decided to stick it out and you finished dental school. At what point did you discover that there's this alternative path that you could gain additional expertise? How did you come across that?
It started with following a couple influencers like Dr. Rotary Thomas that they do really beautiful dentistry. And instead of doing crowns or ceramic veneers on the front teeth, he uses filling material or composite, or as he says, composite in England.
Yeah.
And I thought, wow, I didn't realize this was possible to this degree. I mean, what he can do with his hands and materials surpasses what most ceramists can do. So I thought, okay, this is interesting. And as I went down that Instagram rabbit hole, then the algorithm started pushing other content to me. And it opened up this wide world first of the restorative aspect of biomimetic dentistry, saving teeth that I was taught could not be saved. Avoiding root canals and treatment, or avoiding root canal treatments in teeth that I was told that was impossible to avoid. That's the only option. Like, wow, this feels so much better because I felt like traditional dentistry as I was doing it day in and day out. It's kind of emotional for me because I'm removing all this healthy tooth structure to do a crown when only a quarter of the tooth is affected. Like, this doesn't feel right.
Right.
And then that naturally led to finding the functional approach of zooming out, okay, not just restorative work, but also what's going on in the mouth. Why are we getting cavities? Why are we breaking teeth? Why is there grinding? Why, what's going on? And then how do we actually fix?
So where does one find that kind of education? Obviously, you didn't get all your education off of Instagram, but that inspired you to go find the education. Where do dentists who are interested in this kind of work, maybe disillusioned with the current state of dentistry, how can they expand their skill set? Where did you learn this kind of stuff?
I learned a lot on Instagram.
Yeah.
to be totally honest. And then YouTube as far as technical skills. But yes, once you can only learn so much, you learn little bits and pieces of the puzzle. I'm not Instagram and YouTube trained.
Right. You have the foundation of a degree in dentistry. You understand the pathophysiology from the things that you were taught. And it's very similar to me. I can watch a video on Instagram where somebody's talking about sunscreen ingredients, and maybe there's a new sunscreen ingredient that's available in Europe. It doesn't mean that I got my sunscreen understanding from Instagram, but it builds upon a foundation of really good education. Yeah,
and it was those accounts that then led me to, for example, in the dental world, in the biomimetic world, Dr. Aliman is one of the leading experts and has been for decades, and he's an educator.
Yeah.
And so finding people like him, and then when I find him and he has courses, then I get exposed to these other educators that have courses. And so then I start pursuing those online in-person, in-person components.
Yeah.
And then from there, it just started trickling outwards to the prevention aspect, and then finding other providers that do biomimetic work, but also focus on the functional side. So then that opened up that opportunity. And then honestly, patient questions. They started asking. I have really, really educated patients that are functional, holistic minded, and they were asking questions I couldn't answer. Mm-hmm. So I started looking for answers, talking with other people, and then started uncovering the truth of, and it's just the lack of information out there about treating oral disease.
Yeah. And I've learned a lot by watching your Instagram content. I had a couple cavities as a kid and a couple as an early adult, and looking at your content, I'm like, some of these were so small that I may not have needed to have those drilled and filled. And it's an area I was like, that's, revolutionary to me. And I have all my wisdom teeth, and I can't tell you the number of dentists that I've been to that are like trying to get me to get my wisdom teeth pulled out. And I'm like, they are fully in, I have space for them. They don't hurt me. And they're trying to convince me that they will fuse to the bone and they'll become impacted and get cavities. And I've never had a cavity on them. And it's just, you get these opinions by going into places. And thankfully, the dentist that I see now he's never tried to yank them out of my mouth. But I've had so many that have. And I'm like, why do you need to do that? I don't think it's preventative. I think there may be other incentives going on there.
Yeah, I think a lot of it's tradition too. Yeah. We are taught a certain narrative, and we are taught a certain pattern in how we practice dentistry. And I think people can get so caught up with that they stop thinking critically, especially when you bring in the insurance aspect of dentistry and how that influences treatment recommendations and decisions. And it's unfortunate because something like wisdom teeth, you're exactly right. If there are no symptoms, if there are no reasons to take the teeth out, then just because it's tradition to take the teeth out, it doesn't make sense. Today I connected with a person that had sealants placed on their teeth. They were low risk for cavities, had sealants placed on their teeth, which are like little tiny fillings without removing tooth structure that are placed inside the grooves of the molars. Yeah. But they weren't placed in a way that got a good bond. And then she hasn't had a cavity since she was a kid. And then fast forward a couple months, she had developed massive cavities, these molars, because her risk factors weren't acknowledged. It was just, you have deep grooves, you get sealants. Sealants were placed incorrectly, traps the bacteria that are naturally there that cause cavities.
And you don't see them for a long time.
You can't see them, you can't clean it.
Yeah.
And so cavities will result because it's the perfect environment.
Yeah.
And that's really unfortunate.
Yeah. And now a lot of work needs to be done.
Yeah.
Yeah. And that kind of leads us into this idea of what causes cavities, because it's the oral microbiome of the mouth. And we know we have a microbiome on the skin, in the gut, and there's good bacteria, bad bacteria. There's other kinds of organisms that are floating around in there. I want to understand more from you on the role of the oral microbiome and how it contributes to inflammation, cavities in the mouth, and then we'll get into systemic disease as well.
I love speaking to this. This is like what pumps me up. Yeah. Because I feel like the mouth is so unappreciated and almost treated as separate from the body. It's like in medical school, how much training do you get when it comes to the mouth?
Very, very little. There's even a funny video that I've seen from Dr. Glockenflecken. Have you ever seen his Instagram?
Yes.
And he has one where he's on ortho rounds, and one of the residents asks a question about teeth because they're bones. And he's like, no, we don't talk about the mouth bones. And like the dentist shows up and he like threatens the orthodontist, and because the education in medical school is so lacking on the oral microbiome, on oral health, on teeth. And I think you go through that, and even if they mention it in a lecture, you're like, I never need to worry about that. Yeah. That's going to be the dentist that takes care of that anyway. So why do I even need to pay attention?
Yeah, it's unfortunate. The oral microbiome, I've heard it said that it's the research is very new as far as like studying the oral microbiome and the complexity and the bacterial species and the balance and everything. Compared to skin and gut, certainly we don't know nearly as much, but we do know key players in disease. Yeah, for sure. Those have been well established, and we continue to uncover research. But that oral microbiome, I'll tell you right off the bat, the people in medicine that get it are the cardiologists. Yeah, they really understand the link. But it's twofold. It's both. We look at cavities, and then we also look at gum inflammation. And when the biofilm or the bacteria, sticky layer of bacteria on the teeth is out of balance, and we have more bacteria that cause cavities, they produce acid. That's how they cause the cavities. So it's not a sugar problem. It's an acid problem. And when they get out of balance, then they actually influence the good bacteria to also produce acid. And they take the calcium out of the saliva and hold on to it so that it doesn't get to the tooth. And then they create acid on the tooth, which pulls more calcium out, and then they hold on to it. So it's this really dynamic process, and then these cavities start to form as they produce acid. So we have to change that to be able to get someone out of the cavity cycle, because a healthy microbiome on the tooth does exactly the opposite. It's like this dynamic process of these bacteria working together to heal the teeth, to take calcium and phosphate out of the saliva and nutrients and pass them through the biofilm to the tooth to remineralize it.
That's interesting. I didn't realize that even the good bacteria, the quote unquote good bacteria, could almost be programmed to start doing bad things.
Yeah.
That's crazy.
And then the opposite is true. The good bacteria can program the bad bacteria to stop producing acid.
And so when you are approaching somebody, I know that you are doing testing to understand their microbiome and then make specific recommendations to correct that. How does that process look like for a patient, and what kind of things are you learning about a person's oral health through those tests?
So the saliva tests are really important because they show us a snapshot of the key players in oral disease. What's interesting is the cavity microbiome, the cavity-causing microbiome isn't as well understood. So the tests that try to test for cavity risk aren't actually very accurate. Okay. And so with cavities, it's really looking at all the different risk factors that are commonly missed. I would say the most missed risk factor for cavities is mouth breathing, by far. Okay. Mouth breathing keeps the mouth acidic, reduces saliva. Those bacteria that create cavities love acidic environments. So then they grow, and then it's really hard to get someone out of the cavity cycle if they're breathing through their mouth. But gum inflammation, honestly, is more important to me because the gum inflammation has a very significant impact on systemic health. Like, cavities are annoying, and if they infect the teeth, then we have major problems. But unless that happens, they don't impact the body like the gums do.
Gum disease. Yeah. So what kind of things are you learning about the relationship with the oral microbiome and systemic health through gum inflammation? I know you mentioned cardiologists are probably at the forefront in the medical community on this. What does the average person not understand about this?
Oh boy, there are a lot. And those saliva tests that have been developed really focus on this aspect, on showing us the worst species. So starting with cardiology, there was an article that was released in the 20-teens, later 20-teens, I believe around 2017, that said that up to 50% of heart attacks and strokes are thought to be triggered by oral bacteria. Because, and they drew this conclusion because they looked at these patients that had heart attacks and strokes, and they looked at the place where the clot was.
Yeah, the infarct or the clot, yeah.
Exactly. And then they looked at the clot itself, and there was a really high amount of disease-causing oral bacteria. And so that conclusion was drawn because of that tight relationship. It was hard to ignore.
Yeah.
And that's one example, and cardiologists get that.
Yeah. So is the suspicion that obviously people have cardiac risk factors where they may have cholesterol issues, other things causing systemic inflammation, but they're getting this bacteria to a location where it's maybe there's some breakdown in the endothelium and you're getting a significant inflammatory response from the body?
Yes.
Okay.
Yeah. So this cascade where we already have this disease progressing in the body, and that oral bacteria are thought to be a triggering aspect where they can tip the scales. And so the bacteria, when there are, something that I like to joke about a little bit is bleeding in the gums. I hear it frequently. Oh, I'm just a bleeder.
Yeah.
My gums just bleed when I floss. They always have. And my response is, if you were to press down on your thumbnail and you were to start bleeding spontaneously from underneath your thumbnail, would you go to the ER?
Yeah.
It's like, yeah, because that's not normal.
Right.
It's not normal to bleed from any tissue spontaneously without injury, and gums are no exception. And what I'm addressing here is that if the gums bleed or they're just visibly inflamed, it means the barrier between the mouth and the inside of the body is broken.
Sure.
And when that is broken, it's an open door for all those inflammatory bacteria and viruses and other species to get into the bloodstream. And then we find them in different organs. And women with breast cancer, it's not unusual to find a high amount of disease-causing oral bacteria in the breast tissue. In different organs, there's even a species that has been found in the brain that crosses the blood-brain barrier.
Wow.
But even if they're not directly getting into other organ systems in the body and causing disease, they're causing a chronic immune response of cytokines and interleukin factors and CRP that then just perpetuate the inflammation elsewhere in the body.
Yeah. Well, I know I recently had a family member who was going through chronic health issues, fatigue, intermittent fevers, just overall not feeling well, and had been bouncing around from specialist to specialist, had no oral complaints. Somebody eventually does a CT on this person, and she has the root of a tooth that's infected, and she has a sinus infection coming from the tooth. And now she's going through all these different things to try to improve that. And that was the thing that was triggering this whole body feeling of being unwell.
Oh, yeah. Yeah, absolutely. And that's where teeth become dangerous is when they do develop chronic silent infections. Then very much become a major issue.
Yeah. So the cardiologists, are they getting their patients to come see a dentist like you to start addressing these things? Where is this being incorporated at in the medical system other than in dental offices like yours?
I feel like that there's still a gap of understanding in how tightly we can work together. So some dentists have been really successful in helping cardiologists see the importance more than just in managing surgery. So cardiologists, before they do an open heart surgery, will send their patients to a dentist to be evaluated and be, signed off for surgery, saying they don't have any, tooth infections, they don't have periodontal disease. And so that's well understood, but I think we need to see an increase in collaboration just in general of when you have a patient, even if they're not going into surgery, that's a box that should be checked is, does this patient have gum inflammation or gum disease? And if so, we need to treat it appropriately instead of just, waiting until we need to do a major surgery or we see significant risk of stroke and heart attack to say, I think it's time to bring in the dentist.
Yeah. I think that's, it is something that I have wondered about because we will prophylactically give people antibiotics if they've had heart valve replacement surgery or a hip surgery, knee surgery where they have hardware in there, because it's well known that when you're working on a tooth, that you could introduce bacteria from the mouth and that it could form a biofilm on that implant.
Yes.
And so if we understand that, it, I think begs the question, why aren't more people looking at this before they've had joint replacement surgery, before they've had a heart valve, before they've had a stent put in, where there's still a risk that you're going through something that's going to introduce pathogenic bacteria into the systemic system.
And I think it's just this perpetual disconnect in medicine that the mouth plays any part in the wellness of the rest of the body. And something that I stress even more is that we don't have to have like full-blown periodontal gum disease. Mm-hmm. And that's what's screened for, right? We're looking for bone loss, for pockets of infection around the teeth, for deep bleeding pockets. But any amount of inflammation is detrimental. You can have normal pockets, which when you go to the dentist and you get a clean in and they poke around your teeth, they're measuring those pockets. But you can have a normal depth pocket, but still have bleeding. Mm-hmm. And whenever there's bleeding, that's an open door and there's inflammatory bacteria. Yeah. So I think it needs to be appreciated even deeper, that we don't have to have severe disease to still have an effect on the rest of the body.
So what are the habits that the average person can implement to help promote a more healthy oral microbiome?
Oh, there's a lot of a lot of good ones. One of the biggest habits is anything to promote more saliva production. Saliva is underappreciated. At large in dentistry, the focus is on products. What toothpaste, what rinse. And while those things can be helpful tools, the best thing to manage the microbiome is the saliva. So allowing the saliva to do its job, taking breaks from food, from meals, from snacks, drinking lots of water, staying well hydrated, focusing on the quantity of saliva. So what I just discussed, the hydration, the rest, and also using things like xylitol is shown to be a prebiotic. Yeah. And also target acid-producing bacteria, which is beneficial, and stimulate saliva, so that's a big win.
Xylitol is essentially like a sugar that we don't break down, but the bacteria can.
Exactly. Yeah, it's considered a sugar alcohol, and it helps to feed the good bacteria. So it works as a prebiotic, like a fiber. But we don't digest it, so it doesn't induce like a glycemic response, a blood sugar response. Yeah. But it's very different than an artificial sweetener. Sure. So I've seen xylitol get a bad rap even in the functional medicine community because it's misunderstood, and it doesn't help when misleading studies come out like last year. Yeah. But if you look at the studies, it's funded by Big Sugar and American Heart Association, which gets their funding from food corporations. Yeah. And xylitol is naturally occurring in the bloodstream. It's a byproduct of sugar metabolism. So that's something that's really beneficial, that something someone can do today to help promote a healthy microbiome in the mouth.
So looking for like mints or gums that have xylitol?
Yes. Yeah, mints or gum. A brand that I really like is Pure. Pure is a really clean product. That's a favorite of mine.
Yeah. We'll have to have a link to that down in the podcast show notes and on the videos. I saw one of your videos on mouthwash.
Okay.
And, I always was like, mouthwash is great. It's going to make your breath fresh and there's no harm from mouthwash. But that was not what I learned from your video. I learned that not all mouthwashes are created equal. And in listening to another dentist, I think he referred to some of your traditional mouthwashes like Listerine and Scope as a nuclear bomb for your oral microbiome.
Yes. Yeah.
So give us the truth about mouthwash. What should we avoid? What should we look for? Should we be using it at all?
So mouthwash, we have to be really careful with. And I like to say if we don't have access to good products, to not use anything at all. Because again, the saliva is going to be what's best. So promoting good saliva health. But when it comes to mouthwash, some of the ingredients to avoid, SLS, like parabens, dyes, alcohol, peroxides even, anything like that is too harsh. And I like to use mouthwashes as prescriptions, really. So one thing I use in my practice is Closis. It's over the counter. I use the unflavored one. It's a couple ingredients. And I'm not telling listeners to go home and buy this.
Right.
But that when we identify certain bacteria,
you're recommending it in specific circumstances. But in general, mouthwash, we have to be really gentle. So I tell people they want to use a mouthwash. I really like Elementa. It's researched. It's gone through toxicology testing. It's effective. It doesn't disrupt the oral microbiome. It's very gentle, so it's designed to just help with maintenance and help with disease prevention and management. Because we have listeners that are in India or Europe or Australia, then just getting some good clean source xylitol, dissolving it in water, just using that. That can be really beneficial to the oral microbiome. Seems like a very simple option.
Yeah, just really, really simple. So I think people get really caught up with what to use, but there are other risk factors that have a lot more weight in improving the health of the oral microbiome than products. And essentially, especially if we choose the wrong product, then it's going to be very detrimental.
Right. You're getting rid of all the good bacteria and you're setting yourself up potentially for a bad cycle of oral health.
Oh, yeah. Yeah.
Very interesting. You touched a little bit on mouth breathing, and this is a topic that I have become a lot more interested in. I read a book, Breathe, recently, which I'm sure you're familiar with.
It's a great book.
And understanding all of the downstream health effects for mouth versus nasal breathing. Of course, being on TikTok 24/7 like I am, you come across the videos on mewing, tongue posture, breathing through your nose. And I'd like to explore this a little bit. First, I do want to talk about the oral microbiome and mouth breathing versus nasal breathing. And then we can get into facial shape, structure, and beauty.
Okay. So oral microbiome, how mouth breathing impacts that is it creates an acidic environment. So breathing through the mouth dries up the saliva. Then the saliva isn't there to keep the bad bacteria under control. So then it's easier for them to start to dominate the biofilm on the teeth and on the gums. In addition, without that saliva, we don't have the nutrients or the minerals our teeth need as well. And saliva is really important for digestion. And so breathing through the mouth has a lot of impacts. And when we get a dry mouth and the microbiome becomes unbalanced, we're also swallowing those bacteria. So it has multiple impacts: inflammation in the gums, risk of cavities. It can contribute to gut dysbiosis because then we're swallowing
those bacteria
those species.
are surviving the stomach acid and getting in all the way to the large intestine where we have the most bacteria.
Yeah, so they're surviving a long ways, and there are some recent studies. There's multiple, and there's some meta-analyses that look at all sorts of different studies on these topics. But there's a pretty well-established association between certain oral bacteria in the gut and mental health.
Yeah.
So anxiety, depression, PTSD, schizophrenia, and so that's also something else that's not very appreciated.
Yeah. I mean, I feel like we could spend hours talking about each one of those.
Oh my gosh. Yeah.
I think it's important to highlight that the oral microbiome can be linked to so many other things, whether it's directly causal or not, or something that can exacerbate it. And this is an area where I wish we had more information in dermatology as well as how the oral and the gut microbiome are impacting our skin, because patients are coming in and they have acne. And why does one sibling in the family have acne and not the others? Why does everybody in this family have acne? And everybody wants to know, is it the foods that I'm eating? And we have very little data on the food. We say the canned response is, well, we have a study that shows that skim milk may increase acne for some people, and foods with a high glycemic index. Basically, there's two studies that we've had a signal for, And I think that there's a much stronger link between the foods that we eat, but also I don't know that a lot of people are asking this question, is the foods that you eat impacting your oral and your gut microbiome and leaky gut, how all these things are tied together. Because, sometimes when I do have patients with perioral dermatitis, somewhat of a type of rosacea, we will address some of the oral products that they're using, but we're not necessarily getting into the bacteria of it. And I don't even know if this is an area where you focus on with your clients on skin issues or anything, or what data you might be familiar with on this.
It's something I want to look into now. Yeah, because it makes perfect sense. Everything's connected. So, it makes perfect sense. But I honestly don't know any information about that. I don't know if that's been a topic that's been explored. But I'm curious to go look now.
Yeah, I know that there's some companies that are focusing on gut health with skin disease. I think one is called Codex Labs, potentially. If that's the right one, I'll link it. But they make oral products and skin products that are designed to work together. But we have these patients with acne, and there's, I've always wondered what's going on inside the body that you have this significant of acne. When you tell me you eat clean, you get good sleep, you're not overly stressed, why does this mom in her late 30s all of a sudden start breaking out with terrible acne? And there's hormones, but there's so many other things that may play a role.
Yes.
So when it comes to beauty, this, people are coming in sometimes to us requesting filler to enhance their chin or their cheeks or their jaw. Mouth breathing can radically change the shape of your face.
Oh, 100%. Yeah, that's extreme. And mewing's interesting. You mentioned that earlier.
So tell us what mewing is. Not just the social media thing here, but what is mewing and what are they trying to accomplish with that?
So they're trying to promote like anterior growth of the mandible to address deficiencies, but the reality is once we become, teenagers, adults, our jaws are not plastic anymore. Right. We can't. So you can change, muscular definition, but, mewing or any sorts of those trendy habits as an adult, they're not going to do anything.
They're not going to grow your mandible.
They're not going to grow your mandible. It is fused. The only way you can grow it is if you go get it split in half and move forward, via surgery. So that's not going to happen. But I'm really glad that these things that there are, viral videos and that this is being talked about, because this is something we can fix in the rising generation. Because the best time to catch it is when, children are small and pre-pubescent. What we see with mouth breathing is, what we see at large in the developed world is small, our small upper jaws, small lower jaws deficiencies, mid-face deficiencies, lower third of the face is deficient, not enough room for the teeth, crowding, high palate, narrow airway, and risk factors for sleep disordered breathing. Just a lot of sleep disordered breathing at large of people that don't breathe well enough, especially at night. And a couple of the major players, two major players to begin to address this are tongue posture and chewing. So the teeth are, and this is what I was taught in school, and it still rings true, the teeth are where they are as a balance of force, physics. So the cheeks and the chewing muscles push in on the teeth, and the tongue pushes out. So many people have a tongue posture that's incorrect. So as a child, if that tongue isn't sealed to the roof of the mouth and forward, and sealed front to back, and that's where we could talk about tongue ties, because the front may be up, but the back isn't if the tongue is tied. Yeah.
So the proper tongue posture is the tip of the tongue right behind the top two front teeth.
Yes.
Getting as much of your tongue on the palate as possible.
Yes.
Keeping the mouth closed. Focus on breathing through the nose.
Exactly. And that expands that upper jaw, and then the upper jaw helps to expand the lower jaw. And so when we see narrow jaws, gummy smiles, vaulted palates, those all result from mouth breathing. from insufficient airway. And then when we have narrow jaws, we have a narrow nasal passage because the roof of the mouth is the floor of the nose.
Because the mouth will start to expand to accommodate more air coming through it because we're using that primarily for that function.
Yes, but expand in the wrong way.
And so why is this an epidemic now? Why are we having more people? I have heard that it's because we're not introducing the right foods early on in childhood, and we're not chewing and we're not developing that musculature of the jaw. And so when kids are just fed soft foods for the first couple of years of their life and snacks that dissolve quickly in the mouth, they're not developing those muscles, and then it becomes just easier to breathe through the mouth.
Exactly right. Chewing is so important for jaw development and growth. I like to make the comparison to weightlifting. You know, the benefits of weightlifting. Increase muscle strength, but increase bone density, and making sure we establish a good skeletal health. But when we chew, those muscles activate the jaw bones. So the more we chew, the more input we give our jaw bones, which encourages growth. So something that there's a doctor that created a myomunchie, which is a device to chew on, to stimulate,
Introduce those pressure forces.
Yes, thank you. Introduce those pressure and forces to help to supplement this, because this is an issue. And I really like what she said. She said when a child starts eating food, we need to take away the pacifier. We need to trade the sucking tool for the chewing tool, because if that's not done as well, kids can develop a poor swallow pattern where the tongue goes forward during a swallow and not up and back, which then puts pressure on the teeth forward and also starts to guide and correct growth. So not only chewing, but that proper tongue posture and swallow as well are crucial to ideal development of the upper and lower jaw.
So if somebody is now an adult and they have more of a habit of mouth breathing, maybe they have a lot of the symptoms that you're talking about, this arched palate, they've had their wisdom teeth removed, and that just speaks to the other thing, is like we evolved with wisdom teeth for hundreds of thousands of years. How could we all have to have them taken out now? It's because of some of these habits and patterns and the convenient foods that we now eat, and we're not developing our jaws. And so maybe I should give some gratitude to my parents. Maybe they did something right, that my my mouth was big enough for my wisdom teeth. And what can an adult do now that maybe is in this pattern of mouth breathing? They have cavities. What kind of can they make a change now and focus on nasal breathing and actually see dynamic changes in the musculature and the nasal passages?
Yeah, definitely. So as far as a couple things to address, so looking at the root cause of what's causing the mouth breathing in the first place, and there can be so many different things, but on the most simple scenarios are where it's just habitual. They just have an open mouth posture, and so addressing that, teaching them where to keep the tongue, how to keep the mouth closed, recommending orofacial myofunctional therapy, which focuses on strengthening and training the chewing, speaking, swallowing muscles. That gets the tongue up and out of the airway, opens up the airway, introduces good swallow patterns. So that just helps to establish nasal breathing. But we have to but sometimes we have to address other structures. We may have to recommend taking out tonsils for some people where they're adults. Their tonsils are too large, and that can be part of the puzzle. There's only so much real estate. So that could be, maybe we need to incorporate some surgery. Another simple thing is nasal spray, just good nasal hygiene, using something like a nasal dilator or a breathe right strip to just hold open the valve on the nose that can collapse. And those can all make a big difference, because we also see patients with chronic congestion, allergy-like symptoms, it can be from mouth breathing, where the pepsin in the stomach gets aerosolized and it travels up the airway.
Yeah.
And then when it hits the nose, it induces an inflammatory-like reaction that's just like allergies. So
yeah. I remember when I rotated through otolaryngology, ear, nose, and throat, I felt like every other patient was being diagnosed with LPR, laryngopharyngeal reflux, where they don't have symptoms of acid reflux, but they're getting just enough up there that's causing irritation, and they're getting sinus issues, and they got a little cough, or they got to clear their throat all of the time. And so it just doesn't have to be full-blown heartburn, but you can be having some of these symptoms.
Absolutely. And one of the reasons why this happens is an increase in pressure on that respiratory system, because with sleep disorder breathing, particularly sleep apnea, or even just noisy mouth breathing, we can have an increase in pressure in that heart and lung space, which then puts pressure on the stomach. And so if we open up the airway and establish a good open airway, then we can treat that symptom by treating the root cause. And it's just unfortunate to see how that's missed. We're not looking.
Well, and when you have that increased pressure here, you're more likely to have sleep apnea,
Yes.
which is going to lead to an increased risk of high blood pressure, increased risk of diabetes. All of these things cascade. Now we're dealing with cardiovascular disease. And then if you have a poor oral microbiome, you really are just waiting for that matchstick to hit this, and potentially with catastrophic consequences. So
100%.
It's amazing. And I hope that people take away how much this is all linked. If you're trying to improve your oral hygiene, your oral posture, you said myofunctional therapy. Is this usually a subspecialty of a speech therapist?
So speech therapists, occupational therapists, hygienists, dental hygienists are some of the main providers that we see that choose orofacial myofunctional therapy as a subspecialty. And that can be really helpful because it trains that correct tongue posture and correct body posture as well, and swallow patterns. So that is something that I just broadly recommend to anybody that is struggling with symptoms of airway disorders or sleep disorders, because just getting the tongue up and out. But in some cases, that's not an option. And then we have to explore, unfortunately, there are better options now, but explore options of surgical expansion of the upper jaw to just create more room, because there's just not enough room.
Which is not fun to go through, but if you look at the downstream benefits of doing something like that, it could be life-changing.
Oh yeah, it'll lengthen your lifespan for sure, because that mouth breathing, we know, induces chronic inflammation, suppresses growth hormone at night, other restorative hormone productions, increases cortisol. And so the body's just in a state of distress day and night. And that takes a toll.
Yeah.
You compound that over decades.
Yeah. That'll shorten your life.
It'll shorten your life.
So, couple kind of rapid fire questions for you. Mouth taping at night, yes or no?
Yes, if you don't snore.
If you don't snore.
If you don't snore.
But if you're a snorer, get underlying causes addressed first.
Exactly.
Gotcha.
Yep, get help first.
Okay. Very popular right now. So I assume everybody knows smoking is bad for your oral hygiene. Do you see negative oral consequences from vaping?
Yes.
What kind of things are people missing that they think they're pursuing a safer option?
Yeah, I mean, just drying out the oral microbiome and exposing it to really harmful chemicals creates a lot of dysbiosis, which again then begins to affect systems downstream. So yeah, vaping is
your mouth breathing when you're doing that.
Yeah,
so, yeah.
It is not good.
Yeah.
Not good.
What about nicotine pouches? Are you seeing negative oral health consequences from these tobacco-free nicotine pouches that people are using? Zins, Lucy, I'm seeing these all over social media.
Those ones, I don't think the research is as definitive. I'm honestly not as familiar with those. Usually it's a closed mouth posture. We can see some irritation of the tissue and some increase in like a white tissue called keratosis.
Okay.
same kind of response you would have if you chronically bit your cheek.
Gotcha.
But to be honest, I don't know for sure
it's
that
kind of a new product category, so maybe more information will be revealed down the road.
Yeah.
Dr. Clayton, this has been incredibly informative to me and hopefully to the audience as well, because I want to introduce my audience to more of these kinds of topics and understand the complex interplay between the different body systems, that nothing really occurs in isolation. And if anybody listening is in the Treasure Valley area or is willing to travel, you'll see them. But what if somebody wants to find a dentist like you in their area? Is there a resource that they can go to find somebody that thinks the way you do about oral health?
Yes. We created a resource called the Functional Dentistry Roadmap because we get that question, hundreds of times a week.
Yeah.
How do I find someone like you? And the reality is this is still, I consider myself a little unique in that I'm trying to combine the best of all the dental worlds, because it's like any industry, it's very, any profession is very fragmented. You have like this camp over here and that camp over there. So trying to bring together all the best practices in one place is unique. So this resource helps people understand what's going on, what the risk factors are, oral disease that could be present, and then how to treat it. So it's going to help them find airway providers, myofunctional therapists, biomimetic dentists, or know what to ask for if there's not a biomimetic dentist they can see or travel to. We give resources on, okay, you need to ask for this, that, and the other. It checks all the boxes of educating patients on how to find a provider. And sometimes they'll need multiple providers to be able to get the care that they want.
But they can at least learn how to advocate for themselves.
Exactly.
So, and the Functional Dentistry Roadmap to Oral Health is going to be our product of the week for the podcast today.
Oh, I love it.
So we always feature a product of the week on the podcast, and that's the one that I want to feature today. I know you guys have given us a code. Use the code Dustin for 10% off on this, and we'll have links to that on the YouTube version of this, as well as the podcast show notes wherever you're listening to that. And I would encourage you guys to follow Dr. Clayton on social media, because he's a wealth of information on oral health, and I've learned so much just by watching your content and in the conversations that we've had. And there's more products that you have available, both free and things that people can pay for, that are all designed to help improve not only the oral health but their overall health. So thank you for producing those and making them available to our audience. And if people don't know where to find you on social media, where should they find you and follow you?
So at restoration.dentistry is our handle. We're most active on Instagram. So that's where we do the majority of our teaching and interaction. But it also gets posted to Facebook and TikTok as well. But Instagram is definitely where our focus is.
Amazing. Well, we'll have links to all of that in the podcast show notes. Guys, go follow Dr. Clayton. I hope you've learned as much from this as I have today. And if you send us lots of questions, maybe we'll have to do a part 2 and go a deep dive on one of these topics we covered today. So thank you for listening, and we'll see you guys on the next episode.